Are you contemplating a medical decision? Are you worried that the recommended treatment may not actually align with your goals? If you're serious about doing what's best for yourself or your loved one's health, this should be your top priority if you're dealing with a complex issue. Sure, your provider's recommendation and even a second opinion may be a great place to start, but it may not be enough, which is why you need someone that specializes in complex medicine and has a hyper focus on quality of life. If you or your loved one has a serious illness, or perhaps just a complex medical profile, so not one major condition, but lots of little ones that are requiring lots of specialists, if you or your loved one have ever contemplating, is healthcare impacting my quality of life? I'm sounding the alarm for you. Now is the time. You need a palliative care consult. Palliative care is a type of specialized medical care for individuals facing serious illness like cancer or cardiac failure. So just like any other specialty, you think like pediatrics or OBGYN or neurology, but palliative care focuses on quality of life and reduces the impact and the burden of different stressors and symptoms. Now, I know what you're thinking. You're saying, hey, I'm not interested in hospice care, but I'm here to very boldly tell you that palliative care does not automatically equal hospice. Hospice is comfort care. It's for end of life when there's no more curative treatments available. And sometimes it's when a physician thinks a patient probably has around 6 months or less time to live. But that is not just palliative care. Sure, hospice is under palliative care, but palliative care is much more broad than that. It's to help the patients and their loved ones and their support systems navigate the complexities of either a serious illness or complex medical profile. So let me give you an example. I was helping a family who's caring for their elderly mother. She was in agonizing pain, and the doctor recommended that she come off her blood thinners to get this new pain medication. So here the family was, knowing she's sedentary, knowing that now she's in pain and she's even more sedentary, she's at a high risk for a blood clot. This was the time that we brought palliative care in. They came with us at the elbow and helped us understand what are the pros and the cons of the treatment as aligned to the patient's goals, the family's goals, and evidence-based practice. Ultimately, what happened is after a pros and a cons, as well as alternatives, we came up with a fit that best met the needs of all of those different perspectives. The time is now. As a clinician that worked in ICUs for far too many years, I saw this firsthand. A seriously ill patient with complex needs comes in, we get them stable, but in an unconscious state, and they're dependent on respiratory and feeding tubes. And now the family is left making a very serious, complex decision that they're not confident in. So us as medical professionals were trying to, adhere to the wishes of the patient, as was the family. And although we could never ask the patient, I can guarantee you that is not the end of life that they signed up for. So the time is now. Have these conversations now. If you never have to act on them or make a decision, that means you did something right. So whether your goal is to cure a condition, control symptoms, or improve quality of life, I can guarantee you one thing, that your peace of mind will improve thanks to palliative care.